Welcome back. Coming up, I'll bring you the very first look at tomorrow's newspaper front pages, hot off the press. We have actually now apparently found out exactly what type of criminal Labour will be releasing early. So that's good, isn't it? But first, the Telegraph are reporting that Labour will move to permanently ban puberty blockers for under 18s after the previous Conservative government introduced a temporary ban on the powerful hormones. It's understood that Wes Streeting intends to take a tougher stance on transgender issues, despite anger that this is expected to draw from the trans lobby and the hard left of the party, as he acts on the advice of the landmark Cass review. The review urged children time to think before sending them down an irreversible path, because people were changing their minds up until the age of 25. Puberty blockers, of course, are an incredibly contentious thing. Well, we're going to debate this now with discrimination lawyer Robin Moira-White and the co-founder of LGB Alliance, Bev Jackson. Robin, I'll start with you. Would you give puberty blockers to kids?
I'm a lawyer, so no, as a lawyer, I wouldn't give puberty blockers to anyone.
Morally.
What I would do is leave clinical decisions to treating clinicians.
OK, but morally speaking, you would have no problem giving puberty blockers to kids?
What I have is no problem with clinicians making clinical choices. And you're right, they're a serious type of treatment, and it needs to be given with great care. But the right person to make those decisions is the treating clinician, not the government.
OK, all right. Bev, I'll whiz it over to you. So Wes Streeting, who has previously been incredibly squiffy when it comes to, I would argue, women's rights as well as trans issues, maybe is now making the right decision. Here we go, a permanent ban on puberty blockers for under 18s, Bev.
Yeah, well, obviously, thanks for having me on, Patrick. Nice to be on again. Obviously, we're very pleased about this. This is an LGB issue. LGB Alliance has been one of our major campaigns ever since we started in 2019, because most of the teenagers involved are attracted to people of the same sex, and most are girls these days, and most are lesbians. And so this is a real LGB issue. And the idea that distressed teenagers should be given drugs when they've got all sorts of problems, anxiety, depression, sometimes abuse in the background, and very often problems accepting their sexual orientation. This is not something that needs drugs. So obviously this was a contentious issue, and that's why the previous government commissioned this very, very long and thorough review by Hilary Cass, which she commissioned 7 systematic reviews on this issue, and she came to certain conclusions. Obviously, since the NHS has decided that, except for clinical trials, that they shouldn't be prescribed, it was really important to quickly close the loophole so that unscrupulous commercial operators wouldn't leap in, and we know that they are leaping in, and that had to be stopped. And so Wes Streeting said at the time he agreed with that. And so we're very glad, obviously, that he has simply followed up with what he said at the time.
Robin, could I ask, excuse me, if a medical professional was fine with it, so if a clinician was happy with it, what age would you go down to? How low would you go when it comes to puberty blockers? If a clinician said it's all right to give it to 10 or 11-year-olds, I mean, would that be all right for you if a doctor said so?
Well, same answer, really. That's a matter of clinical choice. Those blockers are used from a thing called Tanner stage 2, which occurs at different times with different children. And equally, different children know their mind differently at different ages. Bev's position really depends on assuming that there really aren't any trans children. I'm a fairly visible trans person. So plainly, I know quite a few trans young people. And in the last couple of days, I've been talking to a trans young person who's making a choice to head into the law, for example, who's been through this process, who's been enormously helped by having been on puberty blockers some years previously, and is living a very happy, very productive life, about to go to university, about to study, and the individual concerned wants to read for the law. And so there is a single example, known to me personally, of someone who wasn't questioning their sexuality, for whom this has been exactly the right course. And to close that off in the last dying moments of a parliament without proper consultation, which is what Victoria Atkins did.
Okay, all right. I mean, I get what you mean, but I do think people might regard the Cass report as being proper consultation. Bev, can I get you to come back to what Robin said there?
Many people regard the Cass review as very flawed.
All right, Robin, let's go. We'll go to Bev.
I think I don't know why Robin has brought up this example, because this is somebody who's still so young. I'm talking about these longitudinal studies that because regret often sets in like 8 to 10 years later, and Robin is talking about someone who's still very young. So what we need really is some joined up thinking here. Obviously, we're very pleased that puberty blockers should be stopped both by the NHS and with private operators. But we need some joined up thinking, because these are distressed young people. We can't just say, right, stop puberty blockers and then not give them any care. These are distressed young people. They have all sorts of issues. We need a massive investment in youth mental health care, and we also need a specialist unit for detransitioners, people who come along later, many years later, often very complex health needs, and they need a special NHS unit to take care of their health needs. So let's make sure that across the board we take care of these young people and give them the holistic care that Hilary Cass said. Look, I think the main problem is we're not allowed to say the truth here. Let's just say the facts. You can't change sex. And the idea that a child who thinks that they can change sex or that they are the opposite sex, they clearly have a mental health problem. Let's call it what it is and give them the mental health care that they need.
Do you think, I'll give Robin the final word on this in a second, but, to take that to its natural conclusion, and Bev, I mean, do you think that, Robin had a mental health problem?
I'm not talking about adults. I think we must make a difference between children and adults. And I'm really tired of middle-aged men telling us what ought to happen with teenage girls. There's an enormous difference between girls who think they're boys and boys who think they're girls. With girls, it's quite often an issue of an escape from objectification, an escape from a pornographic world, an escape from womanhood. I'd like that to be clear. This is about young girls. We don't need middle-aged men explaining what ought to happen with them.
All right, Robin, there's quite a bit to come back to there, so I will allow you, obviously.
I knew I was trans from age 7 or 8. I would have loved to have transitioned in my teenage years. It wasn't possible because of where I was at my age. So to deny the existence of trans people, which is what the approach does, is wrong.
I thought I was a boy when I was young as well. I was quite convinced I was a boy. I hated absolutely everything about being a girl. And I would have gone through all this, but I would have wanted puberty blockers and all the rest of it. So you can talk about your history, I talk about mine. And we need to give proper mental health care to children who need them.
Both are valid, and both routes need to be allowed by what happens. And to close off one route to a group of people who all they want to do is to live their lives in comfort and support is the wrong thing to do.
All right, it's a good place to end it. Can I just say thank you very much? It is an incredibly difficult and contentious topic to talk about, and I'm very grateful that you both have done that. So thank you very much. There's Bev Jackson there, who is the co-founder of the LGBT Alliance, and we've also got discrimination lawyer Robin Moira White. OK, so, yes, well, that's one thing to watch going forward, isn't it? But coming up, as the ultra-woke